Pregnancy is a natural process, so if it's not happening or if it's not sticking, something is missing. After having a family member go through infertility and experiencing a miscarriage myself, I realized how little support and education women have around infertility. I want to change that. I'm Dr. Jane Levesque. I'm a naturopathic doctor and a natural fertility expert. Tune in every Tuesday at 9 a.m. for insightful case studies, expert interviews, and practical tips on how you can optimize fertility naturally. If you've been struggling with infertility, pregnancy loss, women's health issues, or you just want to be proactive and prepare yourself for the next big chapter in your life, this show is for you. Ladies, today I sat down with Wendie Aston. She is a hypnotherapist and a nutritionist. She specializes in infertility, pregnancy, and postpartum. Now, many of you may have heard about hypnobirthing and using hypnotherapy to support pain-free labor, but hypnotherapy can actually be used for lots of different things, including infertility. So we had a very intriguing conversation about what are some of the emotional and mental blocks that could be preventing you from conceiving in the first place. I hope you enjoyed this episode. Hi, Wendie. Thanks so much for being here.
Hi, how are you?
Thank you. Good. I'm so excited to talk to you. Hypnotherapist, nutritionist. You have your own fertility journey as well that you shared with me. Before we dive into why would you do hypnotherapy for fertility? And, I've used it a lot and recommended it to patients a lot, even for the birthing process. Can we break down a little bit about what hypnotherapy is?
Yes. Hypnotherapy is a state of relaxation. It's a really deep level of concentration where you are in a relaxed state. It's really, really good to get you in a mindset so that you can conceive. You see on TV, hypnosis, they're going to put you in a trance and make you do things. It's not that. It's really a deeply relaxed state where you are under hypnosis and affirmations can be told to you, reframing your thoughts, really reframe your process of thinking so you can be positive and really work through any traumas that you may have surrounding your losses, miscarriages, surrounding your fears of getting pregnant, surrounding your confidence in your body to get pregnant. So that's a lot of times we address all of the different facets of the emotional and spiritual aspects of getting pregnant.
Yeah, it's like this deep state of relaxation allows you to be more present with the body.
Yes.
And so then more things it's basically like it gives space for your subconscious or some thoughts that you've been thinking about, but maybe too afraid to admit to come to the surface. Am I kind of getting that right?
Yes. Like a fear of becoming your parent, a fear of being a bad parent. There's so many things that are in our subconscious and our conscious, and we really have to address them all because they may be blocking your fertility. If it's not nutritional, if it's not another health issue, then it could be the emotional component.
For sure. I always say right person, right therapy, right time.
Mm-hmm.
Sometimes we need to address the parasites, the B vitamin deficiencies, the whatever. But then there is the time for the mental and emotional component.
Mm-hmm.
And I think this is where you come in. So tell us, what is it that you're seeing in terms of some of the blocks that are preventing women from being able to get pregnant and to stay pregnant?
Yeah, a lot of times women are just dreading getting their monthly cycle. And every month that is so traumatic for them because they have such a disappointment that they're not
Yeah.
conceiving that month. And so what I address is really making them really be grateful for having their cycle every month because it shows that they are not in menopause, they have a cycle every month, so they have a chance to conceive. So that is quite common. And then a lot of times I have women who have suffered multiple miscarriages, and so when they suffer a loss, that can be very traumatic. Infertility in itself is traumatic. So we address really in hypnosis grieving and really understanding, we have suffered a loss for, the husband and wife, and going through that and allowing your mind and body to heal in a certain amount of time where you feel like you've grieved, you've overcome the loss, and then the confidence to go forward and try again. And sometimes women are so fearful after they've had one loss that they have that in the back of their mind every month. If they are pregnant in the first trimester, that they're going to have another loss. So I go through hypnosis to really get them in a mindset where they are going to be confident that their body is in a healthy state, that it can conceive and stay pregnant for the 9 months instead of worrying constantly about, oh, I'm pregnant, I'm 4 weeks, 5 weeks, 6 weeks, and have that constant worry is not good for them. So they really have to concentrate on
Mhm.
being positive and grateful once they get pregnant and keeping that mindset through the entire pregnancy. So that's something,
Easier said than done, right?
yeah, that's why I'm there, so to support them, because I work with couples, from the beginning of preconception throughout pregnancy and postpartum, so they can have that support if they need it.
Yeah, absolutely. I love what you said about that infertility is trauma on its own. And I think, you know, recently this patient, she just gave birth in August and she had a pretty traumatic experience with birth. I just think the conventional system didn't handle it very well either. But she was so hyper focused on getting pregnant that she didn't realize that, you know, the pregnancy itself was like this big event.
Mhm.
And she just kind of carried that trauma through from the infertility to now being pregnant and worrying about going out, doing anything, hurting the baby, like, oh my God. And so it can catch up with you, you know, even once you're pregnant.
Yeah.
Because sometimes we're just thinking, like, when obviously, like, I work through the pregnancy and postpartum as well with my clients, but they're all struggling with infertility. And then you're like, if I just get pregnant, then I know I'll be fine.
Mhm.
Sometimes I don't know if that's the case, you know?
Yeah, and oftentimes I have women who've had one child, a healthy child, a healthy
Hmm.
pregnancy, but their birth was so traumatic. They've had a
Yeah.
C-section, or they had a very long labor and they didn't do hypnobirthing, which is hypnosis for birth, and that's interfering with their ability to get pregnant. And so that, if I really recommend, if
Like the second time to get pregnant
yes,
because they're like reliving the trauma the
right. So,
first
so
time.
their body
Yes.
isn't
Mm.
allowing themselves to get pregnant, because
Yeah.
as soon as they get pregnant or they think of getting pregnant, their cortisol levels spike, like, oh my gosh, am I going to have a horrible second birth? So healing that birth trauma from a first birth is so important, so they can have a
Yeah.
second healthy birth and have a second healthy pregnancy, because that may be the reason for their infertility and they don't even realize it, because it's not going to be addressed by regular mainstream doctors. They're going to say, oh, we don't know why you're not getting pregnant, but addressing that birth trauma is so critical.
Yeah. I can honestly speak that from my firsthand experience because my first birth was very traumatic for me. And I just remember thinking, like, I want to have more kids, and there's no way I'm going to go through that again.
Hmm.
But I've now met, you know, patients who've said they've had a traumatic birth and it's like they don't think having more children is for them. They
Hmm.
always dreamed of having a bigger family. But because this happened, it's like, I guess it's not meant for me to have more
Hmm.
kids.
Hmm.
And I always tried to empower because it's like, that's what happened to me. But my thought was like, no, 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 this isn't normal. You know, it shouldn't be this difficult or this hard or this dramatic, you know, or
Exactly.
whatever. Yeah, it was just so using that. And I had to do a lot of work to heal because it was like, it took me years to recover from that.
Yes.
Physically, a lot less time, mentally, emotionally, a lot more time.
Yeah, yeah. The trauma in the delivery room can, make or break you. And a lot of times women don't realize that they have to stand up for themselves and really focus on their
Mhm.
health and not be bombarded with, what if, and that's so traumatic.
Yep. And it's hard to make decisions at that time too, right? Like you have to be making decisions fast and
Mhm.
it's high pressure situation
Mhm.
and it's literally life or death and you're like, you know, pumped full of hormones. It's just it's a lot. And then you have this baby
Mhm.
and then you don't have time to process anything, you know.
Exactly. Yeah, that's kind of why I got really involved in teaching hypnobirthing, because I did use hypnobirthing for my first child and it went okay, but I didn't have a doula, but I did get an epidural. But it caused my leg to be numb for 3 days. And that was traumatic, trying to figure out why I couldn't walk. They did MRIs and everything. And I knew for my second two, I was going to practice hypnobirthing every day that I could to have those, wonderful births with hypnosis. And I did. I delivered the other two standing up with no drugs, no ice needed. So hypnosis for birth, it's amazing. Once you
Yeah.
do hypnosis to, for preconception, to make sure that you're healthy and in a really healthy mindset, and then really go through the whole gamut of getting through the pregnancy, and then hypnosis with
Sure.
hypnobirthing.
I think we just have like a misconception. That's why I wanted you to start out. It's like as soon as you think hypnosis, I automatically go to that someone is on the stage, you're going to get them to do weird things.
Nope.
Or it's like it's just a deep state of relaxation. And really, you could go as far as maybe say it's like it's a type of meditation.
Yes, yes. And, hypnosis can be used for so many things other than, we're talking about fertility, but hypnosis can be used for weight loss. It can be used for smoking cessation. It can be used for anxiety, confidence. In sports, athletes can use hypnosis to really achieve, a better time, whatever their sport is, and like Olympic athletes and that type of thing, to really get yourself in a state of, winning the game. And people have such a fear of public speaking, but it can be for that too, because that's a fear or a phobia. Like I had a
Mhm.
client that was afraid of driving on the freeway, and she was able to drive after working with me. So hypnosis is the gamut. I mean, they use it for pain too. And that's how, hypnosis for hypnobirthing is, alleviates pain, because the reason
Yep.
we have pain is because when we have fear, it releases hormones that cause pain. And so in the early
Mm.
1900s, they used hypnosis for dental work. So it's just come so far. It's amazing what it can be used for.
Yeah, that is amazing. Tell me, do you notice a theme in terms of the types of traumas that are popping up for women who are struggling with infertility or with recurrent pregnancy losses?
I would say the most popular, I mean, unfortunately, reasons for infertility: birth trauma, that I use
Mhm.
hypnosis for, birth trauma
So the birth trauma that the patient experienced themselves when
themselves
they were a
before,
baby.
yeah, and then
Yeah.
miscarriage. Because the miscarriage is, they're so elated, they're pregnant, and then they have an unfortunate miscarriage. And that is just so traumatic. And I would say those are the main two. A lot of times that I have clients come in for the miscarriage and then birth trauma.
Mhm. Are they actually like remembering the birth trauma? Or sorry, are you saying birth trauma from the current, so like me giving birth
Yes, yes.
and I had the birth trauma versus me being born?
Yes, the woman, having something go wrong in the hospital, whether it's a C-section or a really long labor and that type of thing. But it's funny you bring up that there is birth trauma of our own births when we were babies that we
Yeah.
probably do not remember. So that's where we go back into, hypnosis and really saying, okay, our childhood, what happened in our childhood? What happened in that? They call it rebirthing. Is another term that I don't know if you're familiar with.
Yep.
Rebirthing, where you go and, hypnosis and you're in your mother's womb. And because back years ago they used to use forceps, and they could be quite violent, for a baby that wants to slowly come into the world. And then we, have the scalpel and, have the C-section or the forceps and whatnot. And that, it changes the structure of the baby. The baby probably needs to go to the chiropractor after birth and that type of thing. And so even though the baby mentally doesn't remember that, it's in this conscious, and it's in our cells. Like our cells have memory. So
Hmm.
that a lot of time, there's so much that we don't know about the mind and the body that we're slowly beginning to know. That needs to be addressed too. If it could, I always ask, like, how was your mother's birth? Because that'll say a lot about how your fertility and your birth is going to be.
Yeah. Even like your relationship with your mom. I mean,
Yes.
sometimes it's relationship with dad, but relationship with mom for sure.
Yes. Yeah, that can play a pivotal role in your ability to get pregnant. Whether your mom had an easy birth, that can play a role. Or if she had a difficult birth, that can play a role, because maybe you want to have that same happy birth that she had, but you still have a fear. Or maybe your sister had a really horrible birth and you're thinking, okay, I'm going to have a birth like her. So that's a lot of times I tell women, we really want to see what other people have to say, but we don't want to have all these negative stories, because the negative stories are going into our subconscious. And if someone that maybe they've had like 10 rounds of IVF and you're thinking, oh my gosh, you know, that's going to be me. So it's good to share stories, but we don't want to like take them in too much, because they're in our heart and soul and we're listening, and that's going to be in our
Hmm.
subconscious.
Yeah, I do find it's a hard line with infertility because you want to be in a circle surrounding with like-minded people and like to connect and you're going through the same thing. But then there's this also, hey, I've been struggling for 5 years. Well, I've been struggling for seven. Oh, I've had three miscarriages. Yeah, well, I had five
Mm-hmm.
miscarriages, right? And then we start comparing, and it's like, it's just such an awful thing to compare.
Mm-hmm.
But like you said, it also feeds into your subconscious of like, well, I don't want that to be me, you know?
Mm-hmm. Yeah, it's really hard. It's good to get a positive mindset too, so you can, if someone is going
Hmm.
to tell you a bad story, that you're like, okay, keep it at a distance and really focus on my wonderful power story, that my belief system is so set up that I am going to get pregnant. I believe that my body can do this. I believe my body can heal, and my mind and my soul can heal with hypnosis to get pregnant, and with my good diet and all the good things that you're doing with environmental toxins and all that stuff. So it's a mind body soul connection is what I like to tell my clients, because you have to address all of it. You can't just address the food. You've got to address it all.
Yeah, for sure. I mean, I think the space that we create as women has to come from, and it's like you're creating, from a place of abundance.
Mhm.
And there's a lot that requires physically, But I wonder what you think about this actually, because there's a lot of women who will feel like there's a soul talking to them,
Mhm, mhm,
right? And then they can't bring it into this world. And so that brings them a lot of pain and
mhm,
they're looking for that connection.
mhm.
There's a lot of people who don't. I don't know if like I've talked to a couple of my patients about it to just be like, do you feel like there's a soul coming? And like that's why you're sad because it's not here yet and you're missing that connection. They're like, I don't really think about it like that. They just want to connect,
Right.
you know?
Yeah, yeah.
Curious what you think.
Yeah, I've had a lot of clients say that they can feel a soul around them, like a baby's coming in. And see, that's the other thing too. Depending on your belief system, you may feel like, okay, I feel a soul coming, but other people are like, oh, who can feel a soul coming in? And so, but I mean,
Those who create
I've had
it.
friends that are very intuitive that were like, oh, I can feel babies around you, other babies around you. And they can see or feel things that we can't see or feel. Everybody has their own gifts. And so there can be something too that, and the other reason too, as we say, where as much as we want to get pregnant yesterday, it's not always up to us and what we want. What if that soul has another timeline? What if there's a
Mhm.
greater power that is not our timeline, it's their timeline when they're ready to come into your body? Maybe your body's perfectly healthy. Maybe you have overcome all of your traumas. You've done the mindset work, you've done the hypnotherapy, and you are in a positive, happy space mentally, emotionally, physically. And it's just not the time for the soul to come in yet. It's not in divine timing yet. So that has to really be addressed. And if you don't address that part of it, then that's where the disappointment comes in. So sometimes I have to like gently explain to clients, if they're doing all the right things and all the labs look good, everything in their lifestyle is perfect and their mindset and everything, not even perfect, doesn't have to be perfect, but
Yep.
the chances are greater. And we haven't discussed, okay, maybe it's just not the right time. And there's nothing we can do about that. Is just wait,
Yep.
and keep trying. As hard as it is to have to
Yep.
say, it's something to be
Yep.
addressed with divine timing.
Yeah, I think about those things all the time, just from a perspective, because I always address the physical, mental, and emotional. And, just got off a call with a client where it's like, everybody else is getting pregnant. Why not me? Why it's like and we know they're not doing anything to
Mhm.
support their fertility. And so, of course, there's that, whether it's jealousy, bitterness,
Mhm.
frustration, all
Mhm.
of the above.
Mhm.
But it's being able to almost put blinders on and say, like, hey, I'm on my own path, and there's something being connected to the divine God, universe, whatever you
Mhm.
believe. I think too many women, and like I can say that I don't know, actually, I've never asked my mom, but like so many times we're just kind of told like that's just the next stage of your life.
Mhm.
You get pregnant and then you should have babies. And there's a lot of women who don't want to really have babies anymore and they had babies anyways because they felt the pressure.
Mhm.
And then there is the like, oh my God, if I don't have babies, then I'm not a woman.
Right.
And we're kind of like, I think, deconstructing all of that now,
Mhm.
you know?
Mhm.
I hope so, anyways, because it's like at the end of the day, it should just be your decision
Exactly. Yeah.
and your own connection to what is it that you want to create in this life,
Mhm.
including a child.
Exactly. Yeah, that makes a lot of sense. Yeah.
But yeah, so how do you unpack some of that in terms of like what actually happens in the appointments?
You mean the hypnotherapy appointments or the overall?
Yeah.
Yeah, the hypnotherapy appointments. Usually, I work with clients in a 3-month package. And so we go over nutrition and all of the toxins and that kind of thing. And so then I would say about the second or third session, I get to know the client and really unpack what their levels of trauma are, and then go through the hypnosis session. And that has a questionnaire that I send out prior to the hypnosis session so I can get an idea of what their goals are and what they want to address exactly. And then, for them to choose as we go into the relaxation part of the hypnosis, if they choose like the mountains or they like the beach, or figuring out what is going to speak to them and what kind of learner are they. Do they are auditory or kinesthetic? So I can
Kinesthetic, yeah.
really figure out how to address them in the hypnosis and how to speak and what words are going to work for them. And then we get into the hypnosis and really work on if it's the grief, of miscarriage, we get in and we address that. Or if it's, maybe they're just anxious, maybe they have a fear of needles, so every time that they go to get blood drawn to get their labs done, they have an extreme fear of needles. And so then we'll get into the hypnosis on overcoming the fear of needles. And then in the hypnosis we
Mhm.
do some affirmations and then slowly bring them out. So hypnosis sessions can be from about an hour and a half to 2 hours, depending. But a lot of the pre-work is done before the first session. So I know exactly what we're going to work on during the session. And a lot of times it's going to take 1 or 2 sessions or even 3, depending on what the trauma is. Because first, we want to address if it's the loss, we want to address the miscarriage. And then we want to address their mindset and really getting them in a place where they're positive thinking about getting pregnant, and then reinforcing that with maybe another session. It's really all individualized
Yep.
depending what everybody's going through, or maybe somebody suffered a rape when they were a teenager and that hasn't even been talked about with anybody. And so a lot of time it's like, they don't want to talk about it, but if their OB/GYN has never asked, like, what if that's the reason they're not getting pregnant?
Sure.
So it's a lot of difficult subjects can come up. So I try to like gently put it in the questionnaire and phrase it in a way that, to give them some space. And if they don't want to talk about it, that's up to them. But I have to say, if this has happened to you, it's something that we do need to address because it could be affecting your fertility if there's no other reason.
It for sure is. Yeah.
Yeah. Yeah.
Yeah. I think it's just hard. I mean, so this is kind of what the question I asked is like, what are the common themes that you're seeing in terms of traumas? So I think infertility is a trauma. I think having miscarriage is a trauma, but I think leading up to that point, like this is what I see in my clinical experience is like the infertility is just showing up the trauma that's been there
Mm-hmm.
for a long time.
Mm-hmm.
And so a lot of the times it's passed on from generations,
Yes.
right? Like
Yes.
I have women with premature ovarian failure who are telling me stories about what happened during the time where they got their menstrual cycle,
Mm-hmm.
which was really stressful, whether there was a divorce or a big move
Yes.
or something else, right?
Mm-hmm.
Like in school, they were bullied.
Mm-hmm.
And then we go further and it's like, oh, between 0 and 5, there were so many chaotic things that were going on. I never had stability or my
Mm-hmm.
divorce, whatever,
Mm-hmm.
whenever that happened. And then sometimes you go even further back and be like, what was the pregnancy like with your mom? And it's
Mm-hmm.
like, oh, my mom was married to an alcoholic. He was unstable. Like, you're just like, are we really like, that's the trauma.
Mm-hmm.
Obviously, it's frustrating not to be able to get pregnant and to essentially go into early menopause at the age of, 30,
Yeah.
35.
Yeah.
But we have to go back and be like, why did the body do that in the first place?
Mm-hmm.
And so that's why I was wondering, like, do you see themes like that in your practice where like everyone who's struggling with infertility tends to have X, Y, and Z?
Yeah, I would say most of them are more recent. A lot of them haven't really gone back to like their childhood, maybe to their teenage years. But the whole thing with their cycles, like that is such another common theme of just having horrible cramps when they're teenagers and acne. And so really not having a good relationship with their cycle from the first time that they have it. And so that
Yep.
is quite common, because every
Yep.
month like, they call Aunt Flo or whatever, like the negative connotations, like it's been
Mm-hmm.
told, for centuries instead of, really grasping that it's a beautiful thing and blood is life. So that
Yep.
being grateful. So that is a common theme.
And even putting in like birth control,
Mm-hmm.
right? Now it's like as soon as you had any sort of issues with your cycle, you were just, oh, just go on birth control. You don't need to worry about it. And that disconnect between yourself and your cycle, I think that's huge.
Yes. Yeah. A lot of women having many issues coming off of birth control and not even realizing how it's affecting their mental health because it's making them cranky. And they say it's supposed to make you healthier and help all these things, but it's actually doing the opposite. So that is another common thing that we need to really talk about it and realize that it's not normal to use
Yep,
chemicals.
for sure. And what about the partner? How do you get the partner involved?
A lot of times I have couples come to me and the women's labs are fine, but the men have low sperm count or low morphology, poor morphology rather. And so they're having, the cell phone in their pocket, they're, vaping, whatever it is. And so a lot of times I would love for the couple to come in, with the 3-month program, one of the sessions. If the guy doesn't have any major issues and his sperm have been tested, then, 1 or 2 sessions he can sit down on a call. But I find a lot of times that guys don't want to really help themselves out. Like I'll have guys reach out to me and they'll have, they'll sign up for a 3-month session and they won't make it through the 3 months because they're just like, eh. So, it's oftentimes the wife that is really pushing them to come and really learn, or she's working with me on her own and taking what she learns to her spouse. And so that's another way
Yep.
rather than, me speaking to them, that way. But it's so crucial to help the men as well, because say if they're unemployed and they're not confident about their work, or they have a horrible job, like, oh my gosh, they don't want another child at this point, and the woman really does want a child, that is something that needs to be addressed. And their
Yeah, it's a
confidence
huge
too.
misalignment.
Yeah. And so that could be the reason right there. So, or they just don't have the confidence in themselves to like be the man of the house and, have another
Yep.
child. So maybe we need to work on their confidence with hypnosis. Or maybe they saw their wife go through a traumatic birth and they don't want her to undergo that stress or pressure again. Or they think that, that's going to happen. They're going to have a traumatic birth again. And so he's not confident. So maybe his sperm aren't the healthiest because he is scared. So, it's both.
Yep.
Takes two.
Yep. Well, it does. It's just, you're right. It's harder to get the males to talk or to connect to. They're more logical, right? So
Mhm.
there's less emotions and feelings. No, hypnosis kind of feels as such. So it's presenting it in a way that, like, hey, we're just going to help you
Mhm.
basically create a deep state of relaxation.
Yeah.
So then you can assess, what is going well in your life versus what's not. I find with my males, I have to give them something to do.
Yeah.
Otherwise, it's too, like, it's not palpable enough for them.
Right. Right.
Whereas for me, I'm like, yeah, that feels great. And women in general, it's like, that feels great.
Yeah.
I could do that. Whereas
Yeah.
for them, it's like, yeah, but what do I do?
Yeah. When I have the hypnobirthing classes, it's for the couple. So the men will come to the class and do hypnosis. The first
Yep.
class, we do a hypnosis, and they go along and they do the hypnosis and like, oh yeah, I could taste the lemon. And the hypnosis that we do with the first class. And they're like, wow, yeah, that really worked for me. And so they understand it. But when out of the blue, they, hypnosis for
Sure.
sperm or for confidence or whatnot, they're a little leery of it at first. But for hypnobirthing, they know it's for their wife and it's going to benefit the pregnancy and the birth. And so they're a little more in tune. And
For sure.
they have to believe that it's going to work. They have to believe that hypnosis is a real thing. It's not some voodoo type thing.
Yeah, for sure. I mean, I think even it's like, I wonder how much of it is like, I'll see, so I won't take people on unless it's a couple, but because I find women will say, oh, the man doesn't need anything. But in fact, they're not really feeling supported, And so there's maybe that misalignment that I don't know about. He
Mhm.
might be super supportive,
Mhm.
but he might not be. And I don't know that until, he's in the room, if you will.
Yes.
Because if, like you said, he's not confident, if he's tired, if he's vaping or smoking or drinking still, then to me, and then she's doing all of this stuff to
Mhm.
improve egg quality and, you're in hypnosis and all the appointments, then I'm like, but maybe he doesn't really want to have the child
Mhm.
or he doesn't think that it's important, or like there's just a misalignment in values.
Mhm.
And for some couples, like
Yeah.
that's all they need
Yeah.
is that alignment to come in.
Right. Yeah. Once that alignment comes in, then conception can be so much easier. But it's just a matter of, really having a heart to heart conversation of what are your goals, both of you, and really what is truthful. We're not marriage counselors, but sometimes, we have to
But yeah, you are
ask
for sure.
questions.
Yeah.
Yeah.
I will direct too, but you still have to be able to bring that up, I think, as a practitioner,
Mhm.
because you can sense it, right?
Yes,
You can sense when something is off.
exactly. You totally can.
Yeah. Yeah. I'd love to hear a little bit more about the hypnobirthing and just like how that works, because I've heard like I wish I did it for my births. It wasn't super popular when, like, now I feel like everybody's talking about it, and maybe even, not as much as we should. But
Yeah.
yeah, I just love to hear a little bit more about how it works and what are some findings.
Yes. Well, a lot of times women have much easier births with hypnobirthing. I first learned about it 15 years ago, actually. My husband came across it and he's the one that actually signed us up for the classes. And
Amazing.
so we had like a month to practice. And I really recommend 20 weeks and on, at least 8 weeks before your due date, longer if possible, because, practice helps. The longer you practice, the better outcome.
Yep.
So really hypnosis for birth is, so the childbirth education classes are 5 classes, about 2.5 hours each class. And you learn hypnosis, plus you learn childbirth education. We go into breastfeeding and postpartum and really understanding the whole birthing process and understanding that fear creates hormones that cause pain. And so if we can release the fear, then we can release the discomfort. We can give you confidence and really allow you to have the birth that you envision, and really get to the hospital or having birth in your home or at a birthing center with confidence that you can do this. And a lot of times moms do not even realize that they're in labor till, they are like 5 minutes apart. And a lot of women will be in the bathtub. And, I was in class with a woman that she birthed her fourth baby in the bathtub at home and didn't know she was in labor. So it's one of these things that you hear of stories of women giving birth in taxi cabs, or women giving birth, in a bathroom in an amusement park.
Elevators.
And it's because they had no fear. They had
Mhm.
no fear, and their bodies just did what they were going to do. And the other thing too, I like working with gravity. That's why I stood up for two of my births. And it's so important to think about what
Yep.
position you were in when you were giving birth. So you have the power of hypnosis and the power of hypnobirthing, knowing that your mind, you can envision your cervix opening like a rose. You can envision your vagina opening like a rose, and really learning the breathing techniques, because there are 3 different breathing techniques that we teach. And so combining the breath with the ability to just calmly relax yourself and get yourself in this meditative state where you are so calm and you are so relaxed that anybody that's in the room, you just kind of zone them out and really focus in on you and your baby while you're birthing. And you're mentally talking to the baby, or maybe you are talking, but at that point you're probably breathing, and just really connecting and breathing the baby down instead of the force pushing that they're told at the hospital, push, 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 and like your feet up on your back. And that is not the ideal way to give birth. The ideal way is
Causes a lot of tearing too, right?
exactly. And a lot of times women aren't told about perineal massage, which is massaging of the vaginal area down towards the perineum. And that's why, I did that religiously from like 8 weeks to the due date. That's why I didn't need stitches for my second two. I needed stitches for my first, only one stitch actually, because I gave into an epidural after like 29 hours. I was like, I didn't know what to
Yep.
expect. I didn't have a doula.
The first birth is really hard to have as a good one, I think.
Yeah,
Just because it's like your first time, it's hard to trust yourself,
you don't know. And I only had 4 weeks to practice. So that's why I was like, you need to like practice
Yep.
no. So it's a beautiful, beautiful technique for birth. Just combining hypnosis and then combining the breathing and the calming. And a lot of times in the past, women that were in different cultures, they birthed at home. They birthed in different positions on all fours, or in Africa leaning up against a tree. And we really need to get back to the way that women birthed before, when they were out of the hospital, because really lying on your back in the hospital only made it more comfortable for the physician. The physician
Yep.
was sitting in his chair. It's not really necessary to, they're there for emergencies, and we're grateful that, physicians are there
Yep.
for emergencies and if a C-section should happen. But a lot of times the woman can birth on her own, and we just kind of need someone to catch the baby, or the woman can even catch the baby on her own. It's totally possible. So this
Yep.
country unfortunately has a really sad rate of, birth outcomes, and C-sections have increased. I just saw a video yesterday. I think it was like 60 some percent since the
It's crazy.
1950s or 60s. And the thing is that so much money's made for the C-sections, and now they're selling the placentas to make money. So, it's one of these things, like, we need to take back our birth rights. There are birth rights to really arm ourselves when we get to the hospital. And that's another thing we talk about in hypnobirthing classes, is what to say in the hospital, or what to say in the birth center, or if you're at home with a midwife. It's usually more of a like-minded, calm
Yep.
state that will go the way that you want for hypnobirthing. And so it's in choosing your care provider is half the battle, and then applying hypno.
Oh my God. Maybe even bigger battle.
Yeah, that's like the
It makes a big difference. I remember with my first, like, again, it was really hard to know what to do, but I was 8 days overdue, and I went in for my ultrasound, and everything, she's fine, she's healthy, I'm fine. And the doctor sits me down after and is like, so what are you going to do? When are you getting her out? This is getting dangerous. And I just remember driving home and crying, and I just called my midwife because it was an ultrasound tech.
Mhm.
And I'm like, I thought I was fine. Is this something that I need to be worried about now? And, like, it set the tone for the rest of the pregnancy, which, I ended up inducing labor with just some castor oil.
Mhm.
But, retrospectively, like, I wouldn't have done that if I wasn't in this place of fear. Like, as far as I was concerned, everything was fine. I didn't have any swelling. My blood pressure was great. All my blood markers were great. She was great. It's like she just wanted to stay there a little bit longer.
Mm-hmm.
And then they created this fear, and it just like set the whole thing, you know, it was just chaotic from there on in.
Mm-hmm.
And it's like, you know, I learned my lesson from the
Right.
first one, but it's like, that's a hard lesson to learn, you know?
That's unfortunate. Someone can say the wrong thing and it can change the whole outcome of the birth. That's
Yes.
why I tell clients, if you're in the hospital and you have a nurse that is negative, or they say the little blip when they put the intermittent monitor on, if the nurse has a negative thing to say, ask for a new nurse, because you don't want any negative energy in that birthing suite. You want all positive hypnobirthing energy,
Yeah.
that you can do this naturally. You can
Yeah.
be in whatever position you want and really take power over your birth.
Yeah. I mean, in some countries or in some cultures, I think they like don't even let negative people around pregnant women. Like, they'll protect pregnant women. It's like, anybody who has negative energy, you have to go over there, deal with it, and then you can come in,
Yes.
let alone during the birthing
Yeah,
process.
that's very smart.
And I love what you're saying, because I think it's just the reason that I'm seeing, and, you know, correct me if I'm wrong in what you're seeing in your practice, but I think with infertility, what happens is you lose trust in your body because you're so disappointed in the fact that it's not doing what it's supposed to be
Mhm,
doing.
mhm.
And so then you get to the birth, and the birthing, it's like, it's hard for you to trust it
Mhm.
because it hasn't done it the first time. You never overcame the reason, like, especially when, and I'm not against IVF because I think there is time and place
Yes.
for it, but not at the rate that we're prescribing it,
Right.
and not the way that most people are doing it. From like, you could half the dose of the medication and have the same outcome, if not better. I think it's would be a much better outcome. But, you know, then to like continue to regain that trust and do classes like hypnobirthing, or so you can regain that trust and know that, like, hey, your body is built to do this, and you're going to know exactly what to do in the moment, versus being told by an outside force to like, lie down, put your legs up, push hard. You know, it's like what you're talking about is this huge empowering experience
Ex-
where, yeah,
Yeah, exactly, exactly. Yeah, addressing this in the beginning, suffering infertility for a while and regaining that trust in your body, and then really going through the whole entire pregnancy, trusting that, you can prevent gestational diabetes, you can prevent group strep B, you can do all these things in your
yeah,
pregnancy to get to the finish line and birth naturally, if that is your goal. And that's going to help you easily conceive a second child if that's your wish. So it's really a two-part process, really
for sure.
getting through that infertility and then in the mindset, so you can have the blissful
Yep.
pregnancy. It all makes
Yep.
sense.
I do think that it's like, to me, the reason that I didn't seek out help the first time is because I thought it was a given. Like, I thought that my body would just know what to do, and I would know. And it was like, for me, it was my pelvic floor. It was too tight, and I had no idea. Like, everybody told me, do the pelvic floor therapy 6 weeks after birth. You'll need it. Now we're telling people, oh, you should probably check it out before you even think about getting pregnant, because it might be impacting your bowel function, your menstrual cycle health, right? Like the ability.
Yes.
And so it was like, that's not a good thing to learn in
Mhm.
halfway through labor, that your pelvic floor is tight.
No, no. And I remember with my first child 15 years ago, I didn't even know about pelvic floor therapy.
Yeah,
I
it
mean, in the
didn't
past maybe
exist.
8, 10 years, I think it's starting to come to the forefront.
Yep.
People are talking about it, but it's, nobody
Yep.
knows that, when you
Yep.
sneeze, you shouldn't pee. Like, that's not normal.
Yep.
Like, go to see a pelvic floor therapist.
Yeah, or some sort of jumping or even running. Like, if you
Yes.
haven't had kids and you go out for a run and you're like leaking,
Yes.
that's not normal.
Exactly.
It's crazy to me that what we have normalized. But point being is, like, I just thought it was a given. And I think, and I literally made a post about that on social media. It's like, what your parents had to do
Mhm.
to be healthy versus what you have to do to be healthy and get pregnant is like, it's two different things now. Like, we have to be intentional about
Mhm.
coming back into the body because we're just so bombarded with stuff, you
Yeah,
know?
it's a different world, unfortunately.
Yeah, that's it. So it's navigating that. Anything else that we haven't talked about that you think is important for my people to hear?
Um, just believing in your body. I didn't mention I wrote a book, Going Green Before You Conceive. So a lot of the information
Mm,
about my health journey is in that book. So here's the book about
I love it.
fertility and pregnancy and postpartum. And just, I really, when couples, come to me and they're not sure what the missing link is, I hope that I can help them find it. And, 'cause a lot of times it takes a whole team of practitioners to
I
really
agree.
get to the bottom of infertility. And once you have a team of people, because you need a team. This
You
is
do.
a big hurdle to overcome infertility.
Yep.
And so getting the right practitioners on your side to really look at your labs and your
Yep.
mindset and your blood work and all of that is just something that I enjoy doing, with other practitioners, so
Yep.
we can really get the goal of the baby, and then that healthy birth and postpartum. Because a lot of times too, we don't want to forget the postpartum part, because we don't want to just think that we're going to just take care of the baby. We have to really think of postpartum too. So that's something
Oh, it's huge. Yeah, you're speaking my language. It's like you need a team. I always, even with my patients, like I'm always teaching them how to talk to the conventional system
yes.
and then what other practitioners they might need, whether it's hypnotherapy or some visceral manipulation or something that it's acupuncture, like you name it, right
Mhm.
therapy, right person, right time. And
Yes.
my wish is that everybody actually starts treating infertility as a disease, like as a serious disease,
Mhm.
because to me, it's like if you can get pregnant, especially when you're young, like in your early 30s, to me, it's a huge red
Oh
flag.
yes.
And you'll never hear somebody say, "Oh, I have cardiovascular disease. I'm just trying to figure it out on my own." Like
Right.
you will never hear people say that. But with infertility, it's just like, "Oh, I can't get pregnant,
Mhm.
but everything else is fine."
Mhm.
So then I will just try to figure it out on my own until it becomes,
Mhm.
this big thing.
Right.
And I'm like, no, it's a serious issue. And you have to start looking at it that so then you can get a team of practitioners
Right.
because it will take a team.
Right. Yeah. A lot of times I find that the reason for the infertility, if they say it's unexplained, is it's because maybe one of the practitioners haven't found the root cause and what the real cause
Yes.
is. Maybe there's something like they're low vitamin D, like it's something simple. Maybe they have a food allergy that they don't even know they're allergic to, and it doesn't show up as like anaphylactic, and that's the reason. And that takes a detective to figure that out. So that's
Yep.
why I ask for everything, and they're
Yep.
like, "Why are you 10-page questionnaire?" That's why you're like a
Yeah.
detective
Yeah.
trying to figure it out.
Yeah. I always use this story, and this is not a fertility story, but this is a kid that I used to coach in gymnastics back in the day, and he stopped growing.
Mm.
And they like could not figure out why he was not going through puberty. Like it was just like, what is going on? Turns out he's celiac, cuts out gluten, and he had no skin issues. He had no digestive issues. He had no other issues that he was aware of. He was just not going through puberty. And they were like, what's going on? Like he's 13, 14, right? Like this kid should be growing. Cuts out gluten, and literally a month later shot up a foot
Wow, that's
and
amazing.
then went into puberty. So it's like, you're right. It could be absolutely some random thing that you're not thinking about because it's like they didn't know, but now obviously, gluten is that was, I think, 10 years ago, but it's
Yes.
still like gluten is a big thing. And it's like, it could be something random like that for you.
Yeah, totally makes
Yeah.
sense.
Or it could be that you have this great fear of getting pregnant
Mhm.
because you're worried about throwing up or being sick. I had a patient for
Yes,
that where it was like, I can't tell you if you're going to be sick or not, but you need to deal with this issue because you might be.
exactly. Exactly.
A good way to get over your fear is to start throwing up every day.
Oh my goodness. They
No, yeah, we don't do that, but it's just like, that could be a silly block where
yes.
you have, I mean, essentially a phobia,
Yeah,
right?
yeah,
Of
fear.
throwing up.
Fear, yeah, definitely.
Yeah. And it's like you hear all these women who throw up in their first half of the cycle, then
Mhm.
like, yeah, that's going to maybe block you a little bit.
Oh yes, definitely.
Yeah.
Hypnosis would help that.
And sometimes that fear can carry into the first trimester as well, like where you actually get more nauseous. Do you see that?
Occasionally, a lot of times, if I've been working with a couple for a while, we try to make sure their diet is high enough in protein and really having a healthy
Sure.
diet to start with, because that can prevent, if we're really in a healthy state in the first place, then maybe
Yeah.
it'll lower the chances of nausea.
Yeah, I find there's like the physical reasons and then there's mental and emotional
Mhm.
reasons as well for the nausea,
Yeah.
and so it's like if you've taken care of all the physical, then you look at apprehension around the
Yes.
pregnancy, all that kind of stuff, like lack of belief that it's going to happen, or that you're right, like lack of connection to the baby because you're like, maybe I'll lose this
Yes,
one.
fear of miscarriage. That's, yeah, that could cause
Yeah,
nausea.
it's
Any fear can cause you to be nauseous and anxious and just high strung.
yeah, for sure. Well, thank you so much, Wendie. Tell people where they can find you.
Yes, they can find me at Wendie Aston 1 on Instagram, and then Wendie Aston Wellness, Fertility, and Hypnotherapy on Facebook.
Nice. Good. Any other last parting thoughts?
Just, really, if something is not right in your fertility journey where you can't really figure it out, think about the mindset and hypnosis and how it can help you, because uncovering your fears and your emotions are the key to uncovering that missing piece possibly for your fertility.
Yeah, I agree 100%. I think it's like not one thing for one person. And one of my pet peeves is when people say, oh, I've tried everything. I'm like, I don't think it's possible to try everything. Like there's just so many things out there now.
Yeah,
And when the student is ready, the teacher will come.
exactly. Well said.
Yeah. Yes. So hopefully, if you're a student and this is intriguing for you, then check out Wendie and see if this is the right next step for you.
Great.
Thanks so much, Wendie, for being here.
Thank you for this.